Folks, welcome back to another episode of the IMGPH podcast. And today we're very excited to have a very multifaceted guest, Nura Anwar. Nura is the Director of Diabetes Prevention and Pediatric Initiatives at NYC Health and Hospitals. But what's interesting is Nura's career in academia started with a BA in psychology and global dance. Doesn't global dance sound very public health? In that period of time, Nura did other things which we're going to talk about and eventually transitioned into the world of public health, where she did a master's in public health in health and human rights. In between these periods, Nura has done teaching. She's currently teaching at GPH as well with some other classes and doing a variety of other things. We can't wait to hear about your multifaceted career, Nura. Welcome to the IMGPH podcast.
Thank you so much, Aman, for having me. It's a pleasure to come back here and be a part of this podcast.
So tell us about this thing where, how does someone, first of all, what is a BA in global dance? How does one even start there?
Yeah, so when I was here as an undergraduate student, I was at the College of Arts and Science, and I was studying psychology as my major. I was on the pre-med track. I'm South Asian, and in our communities, it's either you become a doctor or you become an engineer in a lot of our families. And I had wanted to be a doctor, so I was in that field. However, Tisch had something called the Open Arts Curriculum. And so you were allowed to do a cross-school minor. So I actually have a minor in global dance. And through the cross-school minor, I took Chinese dance, I took ballet, African, Indian, Kathak, a whole bunch of different classes. And for me, that was the way to stay sane with my science classes. It definitely brought creativity and balance to my life.
And then how was it doing psychology with that? What was the world of psychology like when you were doing your another world of global dance simultaneously?
Psychology, I think it's so important to just understand how the human mind works. And the way the pre-med classes were, it's not a major, right? So you have to have your major plus the pre-med classes. And so psychology was something that I was interested in, especially when it came to research and just all the different topics that are talked about in psychology. So I had that, the psychology part, the psychology classes, the pre-med classes, and then having the dance again. So I would be running from, my morning dance class with 2.5 hours of dance into organic chemistry. And then from organic chemistry, I would have my cognition class. So it was a lot to jumble and to just balance. But at the same time, I think it was rewarding and it just all kind of fell into place.
I'm sure some students watching this podcast right now are doing midterms whenever they're watching this. What is a midterm in the world of global dance like?
For a lot of my classes, we actually had to create our own piece based on the techniques that we learned throughout the semester. And so we presented it to the entire class. You had your time to work on it. And then you took feedback from the students in that class. And some of the professors were, they would say, you don't have to include all the techniques, just one small thing, and then just run with it. And I think I liked having that ability to just kind of think outside of the box. And I would bring in sort of my personal background in dance as well. So I did a lot of Indian dance growing up. So I would try to do a lot of sort of fusion in these classes, and everyone would really enjoy it. So yeah.
I love this. After you graduated, then before you joined GPH, there was a big gap of things you were doing out in the real world. Mm-hmm. What did you do after you finished your undergrad?
To understand that, I kind of have to rewind back a little bit. So when I was in the 7th grade, I really wanted to be a cardiologist. I wrote a 15-page paper about the career of a cardiologist, and family friends had my name saved on their phone with --cardiologist. So it was something that everybody knew. I made it completely viral, I guess you could say. But then as I was taking my pre-med classes, what I had also done was I was shadowing a lot of doctors. And as you mentioned at the beginning, that whole multifaceted part of me, doctors would tell me that, if you go into the field of medicine and you practice as a physician, you're going to have to sacrifice a lot. And so a lot of these skills you have, the dance and all these things that you're involved in, you may have to let go of that to just focus on medicine. And, they were like, are you really ready to make that sacrifice? And is it worth it in the long run? And so keeping that in mind, I actually decided after I completed undergrad to not take my MCAT. So all I had to do at that point was just take the MCAT and apply, but I didn't do it. And I decided, you know what, let me go into teaching for a while. Because again, I was in this phase of where I wasn't completely sure what I wanted to do. And public health at that time also didn't quite align with my life yet. But while I was teaching, I came across some organizations and just where I worked. So I found a lot of inspiration from my mentors, and that helped me pivot into public health.
What kind of teaching was it? So how did you even get started in teaching?
I used to be like a tutor. I would do like one-on-one tutoring since I was in high school. And so after I graduated from NYU, one of my best friends, she actually opened up her own learning center. And we went to NYU together. We volunteered together. And then she got her master's in neuroscience while I was still kind of, trying to figure out what I should get my next degree in or where to take life. And she opened up her learning center. And together with her, I helped sort of create curriculums, and I was doing a lot of one-on-one tutoring, but also doing classes. And so, doing your regular ELA math type of courses, test prep courses. And then at the same time, another opportunity came up where I started teaching at a nonprofit called the College Readiness Program. And that was funded by DOE. And in that program, I actually worked with high school students who were applying to college, who came from either low socioeconomic status, or they're the first ones to go to college in their family, or they had a lot of barriers when it came to accessing education. First, that started off as just SAT test prep, and then that started to pivot into helping them do their college essays, preparing for college, going through FAFSA, going on college tours with them. And just listening to all their stories and everything, and just understanding like how important it is to have a mentor and to have someone guide them through the process, because I myself didn't have a mentor to help guide me through this whole college readiness process. And through that, I was enjoying it. Again, like I said, I learned a lot, and especially I think there was a point of connection to those students because I'm also from an immigrant background. I'm first generation here, first in among my parents to go to college. And so I think that relatability and being able to create curriculums, talk to families, talk about the importance of education, I think that was really near and dear to my heart. And that's probably why I returned back here to teach again in the future. But yeah, that's sort of how I went into that.
So it seems like you're guiding students through their lives and making big life decisions, something that you didn't have access to, but you figured it out on the path and you wanted to create something for others in the time you had. And then I'm curious to know, how did public health come into play then from there?
One thing I did as an undergrad student, and I tell my undergrad students now to do this too, you need to network and you need to attend as many conferences as you possibly can. So while I was pre-med, I attended a lot of different conferences, from picking up stethoscopes to learning about how other folks of color got into medical school or how they pivoted in their careers. And I had all these materials that I picked up, their brochures, their flyers, all these things. And so I was I was looking back at those things, and that's when I saw, there were pamphlets about getting a public health degree. At the same time, at the College Readiness Program, the director of the program, I was speaking to him, what should I do about my career? What do you suggest? And I had spoken to him, and I was like, I really want to explore public health. It sounds interesting. And then I kept attending info session after info session at different schools. And I won't forget this, but there was one specific story where the dean of the school during the open house had mentioned how she's a provider, and she said how she had this patient who came into her office and complained about back pain. So she, as any doctor would, she diagnosed the problem and she gave her medication and said, let's try out this medication, come back to my office in 3 months. So the patient comes back in 3 months and the back pain is still there. And the provider's like, did you take your medication? And the patient's like, yeah, I did. I took my medication, and the medication's, she finished the container too. And then the doctor starts asking some more questions about, oh, where do you live? What do you do? That kind of thing. So it was an elderly patient. And then the patient said that the building that the patient was living in, she was on the top floor. She didn't have access to hot water. And there was like only one, I guess, running line of hot water, and that was located on the first floor. This patient carried buckets of water up and down these 5 flights of stairs, and she's elderly. And so then the doctor was like, I can prescribe pill after pill to you, but until your housing situation, until your access to hot water, until that situation gets taken care of, your back pain is not going to improve. And I don't think I ever forgot that story about all the factors outside of just, seeing a patient and prescribing a medication that can influence their life. And I heard that story. So that was one thing that really had me hooked. The other thing, I know Helen Arteaga was also part of this podcast. Helen was a huge inspiration for me to go into public health. I had volunteered in her clinic with that same best friend who opened the Learning Center in the summertime. Helen told us, you want to, and at that time, of course, I want to be a doctor, but Helen had us anywhere and everywhere. That was also a time where Obamacare was going to get taken away. She had us petitioning, speaking to folks literally who lived in Corona. She had us doing presentations about how much sugar is in your drink, how much is in your cereal, speaking to patients, shadowing doctors. She had us anywhere and everywhere. And she kept saying to us, if you want to be a good provider or you really want to serve the community, you need to be involved in every single part of what is considered healthcare. And so I started sort of connecting those pieces. And before you know it, I applied for the advanced certificate programs. So those are the programs where you take the core classes of the public health curriculums. And then if you like it, you can go ahead and pursue your full master's. Or if you don't like it, it's not going to hurt you, right? Because you took the general courses. And so I did that. I did that at NYU. And then I was like, okay, I'm hooked. This is it. This is what I want to do. And I always say this, I don't want to help one person at a time. I want to make sure that I'm able to help a population at a time. So what can I do where it's not one-on-one, but really like something on a grander scale? Yeah.
Health and human rights. I think that's where that kind of came in, right? Where everyone has the right to this. And that was your core belief, I'm assuming, that made you take this direction when you did your degree?
My concentration for my MPH was global health. And at that time, because I completed the advanced certificate in public health where I took and it was like a general advanced certificate. Because I completed that, when I started my MPH or decided to go into that direction, I didn't have a lot of courses left to take. So I did finish my program early. I will always say this, I'm a nerd at heart. I love school. I love homework. I love learning. This has been me ever since I was a child. So I said, you know what? I could have graduated a little bit more earlier, but I said, let me see what other advanced certificates are offered and what can I take. While I was taking my global health classes, I had a lot of whys that came up. So, why can't people living in sub-Saharan Africa, access this? Why can't people in South Asia access care to mental health? So there's a lot of whys. And, in the classes, they told us about like what the reality is, right? Like, this is what's happening. This is what's not happening. Here's the gaps. But there's this element of knowing about sort of the laws, the policies. Like, there has to be a higher governing board, right, that allows this or that can sort of change access, availability to care, to resources. And one of the advanced certificates was the health and human rights one. So I felt like if I went ahead and I took those classes and I got my advanced certificate in health and human rights, it's like, maybe I'll find out a little bit more about this why that I'm asking about. And it was perfect. Like, it made so much sense. I was like, oh, okay, this makes sense why people can't access it, or this is a fundamental human right, right? There needs to be more happening on an advocacy level, or people need to be held accountable for what they're doing, right? Like, are there things that governments are doing, that decision boards are doing? And just learning about those things, it really helped put the pieces together, I would say.
Were there any pivotal moments in your GPH path that led you to this success that I mean, perhaps let's take a step back in that question, right? Where did you end up after GPH? So when GPH finished, I know you're at NYC Health and Hospitals right now. Did you start there? Did you start somewhere else? What was that path like after you graduated?
Because I had sort of like an advanced standing and I could have finished my degree a little bit earlier, so I actually was able to do 2 internships. So as a part of the GPH and graduation requirements, you have to do your applied practice experience. And so you have to go through an internship, and basically, depending on your concentration, you might have to write a thesis paper, or it might be a capstone project, and we have a poster presentation we have to do. And there's courses you have to take for this. So I actually did my first internship with the Population Council, and that was more global health related work. It was actually about girls' education on a global health level, and barriers and things. After I completed that internship, me being the person I am and always looking for opportunities, GPH used to send around these emails every Friday talking about opportunities that are available to students. And within that email, there was one that came from NYC Health and Hospitals, from Queens Hospital. And they were looking for someone who has a psychology background, has worked with children, and also is in public health.
Wow.
So I applied. I finished my Population Council internship on Friday, and literally Monday, I started at the NYC Health and Hospitals one.
You don't stop, do you?
No.
And then, so when you ended up there, what were the pivotal moments at GPH? I'll ask that question now, that led you into that direction, perhaps. You mentioned that Helen Arceega was a big mentor of yours and a big inspiration as well. Were there any moments that you had while enrolled in the program that took you in this direction?
Yeah, that's a great question. So, it's interesting and funny, honestly. People think sometimes that the concepts that you're learning, if you're taking the global health sort of concentration, some people might think global health is completely removed from like health when we talk about it on a national or a statewide level. There are so many parallels. It's unbelievable. And so when I took my global health classes, there were classes like strengthening health systems in low middle income countries. There were classes about women's reproductive health and what type of programs are available. And, there were classes talking about accessing care, gaps in care. And again, you would think these are issues that are only relevant to like the global world or, again, the low middle income countries. But it's actually, given the fact that we're in New York City and we have such a diverse population and we see, folks from all different backgrounds, those issues are actually very, very relevant to us here as well. And so I wanted to take on sort of internships in the New York City level to understand what is working and what is not working. And then hopefully in the future to take the lessons learned from there and apply it to maybe a future career in more of the global health area. And so, for example, if I'm talking about reproductive health, as part of my internship at NYC Health and Hospitals, one of the things I had to do was I was part of this centering parenting program where families would come in, and instead of having your primary care visits for the child where you just, go in to see the doctor, it was a group system. So you're in this group with all these new moms and new babies, and you have doctors coming in, you have the librarian coming in, you have psychologists coming in, and they're approaching this community as a group. And so to recruit those moms, though, I had to go into the OB department. I had to speak to the moms when they were expecting. So it's like the things that I learned, right, from my reproductive health class, from my LMIC health system strengthening classes, I was applying those skills here, right? And I would say also in the global health concentration, one thing that I really liked, and I tell everyone about this, it was very hands-on. It was very, okay, here's the issue. How are we going to tackle this? And we would also always kind of pull back and think about, okay, what are the different factors that are involved here, right? What are the social determinants of health? How can we change that? What are the small ways that we can intervene to have a larger impact? And so those skills that I learned about sort of on, hands-on, this is what we can do on the spot. In my internship, there was a lot of room for innovation, and my supervisor at that time, who I refer to as my work mom, Dr. Marcy Stein-Albert, she's phenomenal. she took me anywhere and everywhere. So she took me to obesity meetings about obesity development. She took me to a program where they were talking about parenting, maternal health, pediatric health, and sort of the bridge between all three. From deciding, planning charters, all the way to helping complete reports and posters for presentations and conferences. Because she exposed me to so much, and she would ask me, what do you think? Or, you're studying public health. Does this make sense? Or, we want to design a program for youth, for teenagers. What do you think makes most sense? And so I was able to apply that sort of hands-on experience, thinking on the spot. And I was able to bring a lot to the conversation within these internships, which I think has really made a difference for me.
These sound like careers in and of itself while you're enrolled in school. You mentioned this thing which we have brought up before on the podcast, social determinants of health. For someone that's listening to the podcast for the first time, what are social determinants of health? It's something we hear very often.
Yeah, so social determinants of health, I guess the way you can think of it is almost like these are the factors that influence and can impact a person's health that you wouldn't normally think about. And just to give some examples, a person's education level, a person's race, a person's, let's say, where they're living, right? Are you living in a rural community versus a urban community? What you're eating, right? Your environment, all these different things that play a huge role in a person's in a person's life and their health outcomes. There's a quote that we say in public health, which is your zip code determines your health.
Wow.
And I think that's like the best way to explain social determinants of health, I think.
That's a great way. Your zip code determines your health. I mean, that should be a soundbite. We'll probably put that on TikTok. There is I want to know more about the role you're in now. Was that role? I know you applied for that role and it was very specific. It's so weird when I see diabetes prevention and pediatric initiatives in one thing.
Yeah.
I've never seen a title like that in my life. How does that come to play? Is it something that's created? How do the two of them go together?
When I did my internship, it was at Queen's Hospital. It was in the pediatric department. And then at the same time, New York City Health Hospitals, as does many hospitals, now there's this whole push towards having a global health department or a population health department. And New York City Health Hospitals, they have an Office of Population Health and Ambulatory Care. And so within that department, there was a chronic disease and prevention team. It's still there. And under the chronic disease and prevention team, they focus on diabetes treatment, prevention. They focus on different types of cancers. They also focus on developing data and dashboards around obesity, diabetes, all these types of things. However, this concept of bringing in pediatrics into the population health way of thinking of things, people don't always kind of bridge those two things together. And so when I was doing my internship, Dr. Stein-Albert kept encouraging me to apply for full-time positions. And I wasn't totally sure. But there was this opportunity where they were hiring for an assistant director of pediatric initiatives. It would be housed, though, under the chronic disease and prevention team. And so I applied for it. And because I attended all these meetings with Marcy, I had an idea of what they were trying to do also. What are their priorities? How do they want to see not only the lives of patients improve when we talk about obesity and chronic disease prevention, but also what are things we can do on a grander scale, right? Thinking above and beyond for our patients. And so then I had applied to it. But when I applied for it, I actually had to pivot into COVID work because the first day I went into work, I picked up my ID and I came home because that was the day of New York City's shutdown. So I had to I was able to do a lot of COVID work. And then eventually I came back into the Office of Population Health to continue this work of pediatric initiatives. And so I was handling the obesity work group, the pediatric obesity work group. And that's really a group of folks in the system who are really passionate about improving the outcomes, preventing pediatric obesity, and for folks who already have it to talk about treatment and what we can do. And, the earlier you intervene, the larger an impact you can have. And so after that, I started doing a project about the early intervention program. So this is a national program. It differs from state to state, and in New York City, it's a program where children between the ages of 0 to 3, if you have a developmental delay or a disability, you can go ahead and get evaluated by the early intervention program. If the child qualifies, they will receive free services like occupational therapy, speech therapy, those kinds of things. So that was another project that was sort of added on for me to work on in terms of exploring pediatrics. And it came in with an equity lens, right? Like they wanted to take a look at the referrals and the disparities in the referrals for New York City. And because NYC Health and Hospitals is the largest healthcare system, municipal healthcare system in the entire country, we have a lot of not just cases, patients, but there's just always so much going on. So that was the pediatrics part. But then because I'm under the chronic disease and prevention team, there was also an opportunity for me to get trained with CDC and to become a diabetes prevention coach.
Wow.
And so now that role has pivoted into a director role. I'm still doing my pediatric projects, but at the same time, I'm helping to sort of expand the diabetes prevention program, which is an evidence-based program to prevent patients who have pre-diabetes from actually tipping over into diabetes.
Got it.
So those are the different things I'm sort of balancing. And again, like I'm able to put my hand into many different topics, like through this role and unique position that I'm in, which is great for me and just population health and global health and everything that I bring to the table.
When I'm talking to you, I've lost track in a way of how many things you have done. This comes from here, this comes from there, that comes from there, that comes from there. And while some people prefer sticking to one path, you have a multifaceted path, and you have a large umbrella where it's populations, not persons. Persons in terms of population is how you're thinking. Someone who's probably 16 right now watching this, or someone that's signing up for their master's program and thinking, I really want to do something big. Mm-hmm. How do they think like you did? Because you've kind of paved your own way by doing different things, and you have found your why, you've found your path. What was that like for you? It seems like there were a lot of setbacks that happened as well in the process. How would you guide someone in that process where like, try everything, try this much only? What's the prescription for that without being a doctor?
And it's funny that you mentioned without being a doctor, because I do think back to what those doctors told me, right? That like, are you ready to make that sacrifice? And that was something that I kept hearing over and over. Anytime you're pre-med, that word sacrifice or compromise comes up way too often. And so for me, I wanted to kind of shift that. I wanted to think about what is a path that I can go down where I don't have to make so much of a compromise and sacrifice. I'm the one that's going to be working. And if I don't feel happy and satisfied with my life or what I'm doing, so if I don't feel like I'm impacting people's lives, that for me is a point of reevaluation, a time to step back. And you always have to choose, you have to say to yourself, okay, these are the parts of me that I bring to the table and that I like and that I want to continue enhancing, right? Once you select those things, I think it becomes a lot more easier to navigate the path that you want to go down. I would say I'm still searching. I'm still doing a lot, but I still want to say that I'm not kind of sealing down to just one type of specific area, right? And that's also what is a driving force that brought me into public health. It's so diverse, right? Like I can pivot, I can work my director job with health and hospitals, but at the same time, I can also teach, right? And then I can also do advocacy work. I can also do mentoring. So I get to have my hands in many different things. And I think that's the beauty of public health, also public health careers, that you don't have to just say, okay, I'm just going to be a researcher and that's it. There's so many different ways to stay involved and make an impact, right? The more ways you're involved in, the more pathways there are for you to make an impact on someone's life.
Involved to evolve.
Yes.
there's this, you mentioned right now where I can be a director, I can teach, I can do mentorship. The last word, which I didn't hear at all throughout our conversation, was advocacy. What does that mean? We were talking a bit about it offline, off camera.
Yeah.
What is advocacy to you? That this is another big pillar of your life, it seems.
Absolutely. So when you work in organizations, people will always say it's important to understand the organization's culture, right? To pick up on what is acceptable, what is not acceptable. But also within every organization, everyone is working under some boundaries. And those boundaries are the policies that are in place, right? The mottos that the organization believes in. When it comes to public health, a lot of times you can have the grandest ideas, but you also have to know why something is occurring and what you are able to change and what you are unable to change. I was never into politics. I was never into policy. But public health sort of pushes you into that, right? So for example, you have to take healthcare management and policy courses. If you don't know what a certain policy is, it's really hard to come up with an intervention or to come up with a solution to tackle the issue. If you don't like the way a certain thing is going, or you're like, why is there this huge health gap here? Let's say, for example, in mental health, right? Why is it so unaddressed? Why is there this huge unmet need of the need for care, but there's not enough resources, right? Like, what is that missing piece? And a lot of it is from policy. And so you have to advocate for the people who cannot possibly advocate. You have to show up. You have to speak to people who are in, traditionally what we call seats of power, right? Your councilman, your mayor, your representative. You have to show up. You have to let them know what you care about and how that issue impacts your life. What are the gaps there? But you also have to propose to them that, the person that you're going to, like, you are sitting in a position of power, you have X number of funding, and here's what I'm proposing. And this is why we're proposing it. So you kind of bring your plan to the table. And eventually, when enough people talk about a certain plan, it's going to raise awareness. It's going to, turn something on for the person who's making that decision. And if you don't change policy and you don't advocate for change, these gaps that you're so frustrated about or you're noticing everywhere, those are not going to change. So you can't really, move forward. If anything, you're moving backwards if you're not advocating, if you're not doing policy work.
What's really interesting, folks, is that before Nura came to this episode shoot, she's come from work. She's going to shoot this episode, and now she's going to do some advocacy work in Albany, and we're recording this in the city in New York. So Nura, it's really reassuring to see that there are people like you in the world of public health, and I'm sure you're going to inspire a lot of people, and I'm sure you have been inspired by a lot of people that are doing similar things, and we're really glad that you have found your own path, and you're going to continue looking for the next level of your path, because you mentioned 4 things. I wonder what the 5th one is. When that comes up, we'll love to have you on the podcast.
Amazing.
Any final thoughts you'd like to leave the listeners with?
I guess my only final thought would be, don't stop pushing the boundaries. Just because there isn't a traditional path out there that you like, that's totally fine. Go ahead and create your own path. No one is going to say no to you. The only person who might say no to you is you yourself. But learn to just shut that voice down. You're going to face barriers, but that doesn't mean you stop. Just keep pushing forward.
Folks, that was Nura Anwar. Nura, thanks for being on the podcast. We're trying out this new like button thing over here to remind you to like the podcast. And if you enjoyed it, please share it with your friends. And also, put something in the comments down below if you will have any questions or something you loved from today's episode. Nura, we loved having you.
Thank you so much.
See you on the next one, folks.